Hello, this is Georgeann Sack speaking. In this video, I will explain the anatomy of the female pelvis using 4 key concepts. So let's get started. The first thing to understand is that our pelvis is home to several organs: the bladder, uterus, and rectum. And each of these organs has openings to the outside. We have muscular rings called sphincters that contract to keep those openings closed. So here you can see a picture of the female pelvis. She's standing up, her pubic bone's in the front here, and here's her coccyx of her spine on the other side. What you'll see is her 3 organs: the bladder, uterus, and rectum, and the openings to the outside. At least for our bladder and rectum, we have proper ring-like sphincters, not just 1, but 2 for each opening. So for the urethra and the anus, we have 2 rings of muscle encircling the opening that contract to keep them shut. The internal sphincters of both the urethra and the anus are under involuntary control, so it functions without us being able to consciously change its function. The secondary ring, I call it secondary because it's a little further down the tube from the internal sphincter, are external sphincters, and these are under voluntary control. These are the muscles we can decide to contract if we know we're not at a toilet and we don't want any pee or poop to exit our body. In addition to these proper muscular sphincters, we have a vaginal sphincter. This muscular structure attaches to our pelvic bone and surrounds both the urethra and the vagina. I'll show you a better look at it in this picture here. In this illustration, we have a woman lying down as she would for a gynecological exam. What I want to point out here is the vaginal sphincter. The vaginal sphincter goes by a few other names: the bulbospongiosus or bulbocavernosus. It forms this oval-like structure around both the urethra and the vagina. Its job is to contract and squeeze shut the urogenital hiatus. So this whole area in the middle here is called the urogenital hiatus because there are no muscles covering this area. And the only way to close it is for the vaginal sphincter and an additional muscle that I'll talk about in a minute to contract and close the opening. So we have muscular sphincters that keep our openings shut. In addition, we have levator ani muscles. These are the muscles of the pelvic floor you hear so much about. They form a pelvic diaphragm to support our organs. So you can see that in the simplified view here, where the levator ani muscles are this band of tissue in a sling from front to back. But this, of course, is perhaps overly simplified. And so I wanted to show you a better picture of these muscles and point out a few specific structures that are important for function. So here we have a better view. This is a picture of a woman's pelvis who would be lying down. So here you have her pubic bone, here's the spine, and then the levator ani muscles are these structures here. I'll draw a circle around them. They're these ones here in the middle of these white lines. And as you can see, it's not really just a simple sling from front to back. There are several distinct bands of muscles that each have their own functions. So I want to share what 2 of the 3 bands do because they're especially important for pelvic floor function. Okay, so the first one I want to share is the Pubo Vaginalis. This muscle forms an arch around the urogenital hiatus. So you'll remember I said the vaginal sphincter contracts to close the urogenital hiatus, and it's just that muscle and one more that has that job. The Pubo Vaginalis is that second muscle. So you have two layers of muscular arches. The vaginal sphincter is the one closest to the outside of your body. And then a little bit deeper inside, we have the Pubo Vaginalis. And both of these muscles function to squeeze our urogenital hiatus shut. They're both, of course, also very important for sexual function, especially the vaginal sphincter, which can stimulate the clitoris. A second critical muscle for pelvic function is the Pubo Rectalis. So this band of the levator ani muscle goes around the anus. And a better view of that is this one. So this shows a woman standing up. Here's her pubic bone, and here's the coccyx of her spine. This arch here is the Pubo Rectalis. So it is going around the rectum, holding it at an angle so that any feces inside the rectum will not be able to pass as easily through down towards the anus. As you can see here, here's the internal and external anal sphincter below the puborectalis muscle. So these three muscles operate in concert to keep your feces in. Okay, so we have muscular sphincters. We also have supportive muscles that hold up our organs. It's also essential to point out that we have a lot of connective tissues in our pelvis, and these are important for holding our organs in place. I previously showed you this picture of the superficial muscles of the pelvis. The muscles in this picture are shown in peach, but you may have wondered, what's that white stuff? Well, that white stuff is the ligaments and tendons inside our pelvis that connect those muscles to their anchor points, either to bones or to other muscle. And I wanted to point out one central node of attachment here that's very important, and that's the perineal body. So between your urogenital hiatus and your anus is the perineal body. And many muscles in your pelvis all converge on this central tendinous node right here. Okay, another familiar picture. So I've showed you how these are the levator ani muscles here. Again, you see these white lines. So this white line is a tendon. It's a tendinous arch. And it's the connection between the levator ani muscles and another muscle here. Same thing on this side. Here's that other muscle, here's the levator ani muscles, and here's the tendon between them. There's also a central node of attachment here behind the anus called the anococcygeal ligament. So these are the central and peripheral attachment points of your levator ani muscles. In addition, the perineal body would be located right here between the urogenital hiatus and the anus. And this central node of attachment is also important for some of the levator ani muscles, which do interact to some extent with the more superficial muscles of the pelvis. So there's one more type of connective tissue besides ligaments and tendons that we need to talk about, and that's fascia. So fascia covers the surface of every tissue in your body. So here you're looking at a woman lying down. Here's her pubic bone. Here's her spine. Here's the bladder, the rectum, and the uterus at the level of the cervix. As you can see, there is this whitish connective tissue, fascia, covering the surface of every organ and all of the muscles. In addition, you can see these more stringy white structures. These are ligaments. And so here you have a very important ligament that goes from the uterus at the level of the cervix to the sacrum of the spine. So that's the uterosacral ligament, and that is essential for holding the uterus up above the urogenital hiatus, so it doesn't collapse down into your vagina. Okay, so I've talked about three critical concepts: muscular sphincters, levator ani pelvic diaphragm, and connective tissues. These are all very important for keeping our pelvis functioning and all of our organs held in place. We have to remember that the pelvis is part of a larger system, our whole body. In particular, I want to talk about the pelvic diaphragm. That's these levator ani muscles we have here that support our organs. They connect through their connective tissues to the transversus abdominis muscles. These are your deep abdominal muscles. And then on up to your diaphragm under your lungs. And then over to the muscles of your spine, the multifidus, and down. So all together, these create a capsule in your body that connects your breath to the amount of pressure in your abdomen. Now, this is important for many basic bodily movements and for excretion. So I've talked a lot about the functions of our pelvic anatomy. So how could these things go wrong? What would the anatomical causes of pelvic floor disorders be? So if you don't know, pelvic floor disorders include urinary and fecal incontinence. That's where you leak pee or poop. And pelvic organ prolapse, which is where the organs of the pelvis, the bladder, uterus, and rectum, are no longer held in place and bulge into the vagina and down toward the urogenital hiatus. Torn sphincters could certainly cause both types of incontinence. Nerve damage that affects the control of your sphincters or the control of your levator ani muscles could also result in incontinence. The pressure of holding a growing baby inside of your body and then delivering it can also cause your urethra to droop down from its normal position and never return to where it was. Now, this is kind of like tipping a tea kettle, such that now urinary incontinence is more likely if the output from your bladder is pointing downwards. Torn levator ani muscles can cause all three types of pelvic floor disorders. Levator ani muscles will sometimes rip away from their anchor points rather than the muscle fibers themselves tearing. This is a failure at the interface of muscle and connective tissue. For example, the levator ani often avulses or rips away from their peripheral attachment to the arcus tendineus. Torn connective tissues are particularly associated with pelvic organ prolapse, which can be thought of as a hernia. So basically what's happening is an organ that's normally in a very specific compartment of the body now is pushing through the broken connective tissue into a compartment it shouldn't be in. And this creates a number of biomechanical stresses in the body. Reduced elasticity of connective tissues can also cause prolapse. So, for example, you hold the weight of a baby, your belly gets bigger and bigger. Those uterosacral ligaments that hold up your uterus are going to stretch out a lot while you're pregnant. If, after delivery, those ligaments don't go back to their normal size and elasticity, your uterus will no longer be held up and it will sink down into your vagina. Aging can also cause reduced elasticity of connective tissues because as we age, our estrogen decreases and that causes reduced elasticity. In addition, if you have weak muscles, any of the muscles of the core, this can lead to pelvic floor disorder. So I've summarized the anatomical causes of pelvic floor disorders, but in plain language, here's a short list of things that might result in pelvic floor disorder. Trauma to your pelvis caused by vaginal childbirth or high-impact sports are one major cause of pelvic floor disorders. The next largest cause would be aging. As we age, we have reduced elasticity of our connective tissues, as I described. And if you start having this reduced elasticity on top of additional problems, such as reduced muscle strength, or perhaps you tore some of your muscles during vaginal delivery many years prior, then pelvic floor disorders will start to become apparent as you age. A few smaller categories that may lead to pelvic floor disorder are chronic cough, which puts a lot of strain on the pelvic floor, or obesity, again, Being overweight puts strain on the pelvic floor. But by far the two biggest causes are vaginal childbirth and aging. If you are among the many women who suffer from pelvic floor disorders, you can learn more from my book, Kegels Are Not Going to Fix This. You can find it at pelvichealthbook.com. I'll leave a link down in the description along with credits for every image used in this video.